Hi folks, welcome back to the channel. My name is Drew. I'm an accredited exercise physiologist and registered acupuncturist. I've been practicing for around 20 years, both in clinical practice and teaching all kinds of different health and wellness aspects, particularly around yoga, tai chi, qigong, pranayama, integrated with exercise rehabilitation. In today's video, we're looking at spinal extension using a classic yoga asana called Cobra pose. And we're going to be looking at differences between active and passive spinal extension, which you can do in both ways, in Cobra pose and also Sphinx pose. We are using the yoga app from Muscle and Motion. And we're in the back bend section, we're in the asana section, and we're looking at this pose here. So let's get into it, shall we? So a lot of these little animations here starts off. So this is the end position of your cobra, so spinal extension. And we can see here yellow muscles are lengthening, getting stretched, red muscles are contracting. And you can do a nice 360 kind of degree orientation of the pose. Now this white kind of strip here is just to demonstrate the angle of the sternum. So as we come down through the posture, so the sternum is facing down, and then as you come up, sternum is facing forward. So often a cue is to kind of lead with the chest or lift the sternum to get that nice angle in the back bend. We'll pause here. We can see all these muscles in the back. So we've got latissimus dorsi, we've got the lower trapezius here, middle trapezius here, and then we've got all our rectus spinae muscles coming down. So all these muscles are going to be active. Purple is the triceps, so they're going to be actually creating a lot of the push up. So this is going to be important when we're going from active to passive extension of the spine. So just a beautiful diagram there. So let's go on to the second one. And we're not going to go through the entire thing. I want you guys to support this yoga app. It's a really cool app, and you can go and get your own copy of it. So here we've got primary muscles. There's the trapezius muscle, so middle back. The rectus abdominis are getting stretched, so I'm going to get lengthened. Also the rectus femoris here, they're one of your quad muscles. Pelvic floor muscles are maintaining intra-abdominal pressure and help stabilize the lumbar spine. So typically what will happen as you come up, you're going to be inhaling. There'll be a kind of a movement pushing down this way. So you'll get some eccentric lengthening of the pelvic floor to kind of catch that, the internal organs as they're getting pressed downward. And so you'll get stabilization through the pelvic floor here. When you get up to the top, you'll exhale and then you'll contract these muscles here and create that stability. So great picture here of one of the key aspects of your cobra position is you want to really activate the middle trapezius, lower trapezius, and the latissimus dorsi. So if we go back to here, so these are in a lengthened position, and you'll notice that the shoulder is up. So you're in a shrugged or elevated position. If you press down into your palms with the elbows extended, you can depress there. So you want to depress the shoulder blades. This is such an important move. So for posture, when you can get this muscle here strong, you can pull the shoulder blades back and down. You're going to be really a nice lifted chest. You'll have great muscle activation here, because a lot of the forward slouch posture is because this muscle through here are quite weak, or it is not being very much used or involved. So you can really get those bad boys on. So a lot of upper body postural issues are related to weak middle trap and lower trap complex. People who wear their shoulders around their ears or have their shoulders forward or head and neck forward, is often a big contributing factor is this weakness in this kind of middle back region. You can see that. And that's if you're doing tricep dips. So if you got up against the bench, hands behind the bench, you're doing dips. It's exactly the same thing you're going to be doing in a dip. So you can kind of think of doing a cobra like a dip action. Okay. So where you're using your triceps, you're using your middle trapezius and your lower traps to really get that chest up dip work. And the real, to kind of get into that, you want to make sure that the shoulders are pulled back into retraction and then dip, because you want to get these shoulder blades to roll down the rib cage. Whereas if you try to do this move with your shoulders tip forward, what will happen is as you press up, your shoulders will roll forward and you'll come into your neck, and your upper trapezius and your scalenes like to stabilize more, and it'll just get messy. Now here we have the latissimus dorsi, so our biggest back muscle. So the lats are going to be pulling your arms behind you because they're shoulder extensors. Okay, and because of their attachment to the inferior angle of the scapula, they also help in that kind of depression of the shoulder blade, but also because the lats attach onto the humerus here in the bicipital groove, as the lats contract and pull down, they'll also help contribute to that pull down of the shoulder blades through here as well. So one thing when you're doing overhead pull down work, like a chin up or a lat pull down, is you're trying to get the whole shoulder blade to roll down. So you're not going to just pin your arm in place and just do kind of like bicep curls here. You want the whole shoulder to roll back down. This is what we're trying to achieve. So it's a really great image. Love it. Look at that. Just perfect. Okay, let's look at the next one. So nice angle here. We have the muscles that are really getting stretched. So typically when you're doing a back bend like that, you have the agonist antagonist relationship. So the spinal extensors are the agonist, the prime movers. So then you're going to get reciprocal inhibition to stretch the front abdominal wall. So rectus abdominis. And here we have this iliopsoas complex here as well. And that would be the rectus femoris there. So you're going to get a front stretch, which is quite nice. Typically, in my experience, not many people need to stretch out their front abdominals, their front or their abdominals. If you stretch out your abdominals too much, like any muscle, if you don't match that up to strength, it just becomes weaker. And in fact, you can kind of get that kind of pot belly look by having really kind of weak abdominal muscles that slowly just kind of like distend outwards, because they're not contracting the hold in, they're just slowly kind of catching the belly, if you will. And you kind of can get that kind of pot belly look from just very weak or overstretched abdominals. Now, and here's just kind of talking about the position of the sternum, which we were looking at before. And here we talking about two different ways you can do extension. So we have passive extension and we have active extension. So what we're going to do is we're going to jump into another one here. We're going to go into theory. We'll do a sting, and we're going to go into the vertebral column, active versus passive extension. So what we have here is the muscle going to be active to create the spinal extension. So if we pause here. So all the muscles here creating the back bend are going to be triceps, posterior delt, and all your spinal extensors. So your longissimus, your intercostalis, your erector spinae, your latissimus dorsi, your middle traps, your lower traps, your glute max, hamstrings and calves. So this whole posterior line will be active when you come up into extension, meaning the muscles are contracting to create that movement. You can see all these muscles coming up through, spinal erectors, different layers of spinal erectors, QL. Now you can also do that from underneath. So here in fish pose, it's quite a strong kind of asana posture. Even though you're lying on your back, to lift up here, you're contracting the spinal muscles and they're creating the arch against gravity. So this is actually quite a hard position to do. So it's still very active in this position, and you can see the big stretch you're going to start to get through the front line here. Now, passive extension is where you're going to use your arms to create the back bend, where you're focusing on not contracting the muscles in the spine too much. So you can see here, you're resting on your elbow. The chest is up, but shoulders are going to be away. The shoulder is taking most of the load, so the deltoids, triceps taking the load. And then in this one, you've got your passive extension on a Swiss ball. So you're just lying over the ball. That's going to stretch the abdominals here. And then you're going to get the passive extension in the spine. Another good angle there. This is a huge Swiss ball. It looks a bit out of alignment with me, out of balance. You can see the kind of concept there, getting a nice chest stretch is good. So that's a good posture to practice camel pose. So this is essentially camel pose, but you're supported. And you can see the huge stretch you're going to get through here. So camel is really good for opening up the hip flexors and the quads, and developing lower back and glute strength through here. And just like camel, you can do it active and passive. So you can do a passive camel where you're using your arms to press up. You have to use your hips a little bit here to get the hip height up. But once you kind of get the arms, you can lock your arms in position and kind of hold yourself there. But typically, you have to be really active in the glutes to kind of keep pushing hips forward to really open and access that stretch. So the main difference was going to be in active extension, you're recruiting the muscles to get these nice, strong back extension. And the way to get a strong back is to strengthen the back. Passive extension is you're not using the muscles to create extension, you're using a lever from the arms. And what that does is it creates the extension, but instead of the load being distributed through the muscles, it's now distributed through the vertebrae, through the joints in the back themselves. Now, the key thing here is for some people, going into spinal extension can be really, really irritating. And some people it's really, really relieving. So it's a little bit of trial and error. For people who are irritating, it's because if you've got some disc kind of wear and tear, some disc degeneration, and just where the bones kind of come together. Okay, if there's inflammation or irritation there, that can be quite triggering. If there's disc pathology where you go into back bend and it closes the disc space and then kind of compresses the nerve root, that can be quite irritating. So essentially, if there's a joint issue in the lower back, passive extension can be pretty irritable for it, but at the same time, it can be really relaxing. It's not really a cut and clot, closed and cut kind of case. Same with the active extension. So when you contract the muscles, the joints are going to be compressed together. So you're going to have this kind of squishing down of the vertebrae. So that compression creates a lot of stability in the vertebrae. And again, so if you've got inflammation in the joint, if you've got irritation, if there's an injury there, that's pushing the two vertebrae together, could be potentially quite irritating. But for some folks, it's also quite relieving. It really depends on the structure and the injury that's happening there in the lower back. But very easy to modify. So if we come back to, let's go back to our Cobra. So we go back to asana, come back to our Cobra. Okay, beautiful. We get to here. So in our back bend, the way to modify this, so in this demonstration here, the elbows are bent. I personally don't like this technique very much. If you're doing a static hold, because it puts a lot of pressure on the elbow joint itself, but you're essentially taking the weight of the whole torso in the elbow. So what I'll cue people do is when they're coming up here, if they're going to do a hold in Cobra, is to position the hands a bit more further out to the front where they can get the elbows fully locked or extended. And that way the triceps in a really strong position to maintain the load. And you can use your shoulder blades to press in the hands on the floor and then depress the shoulder blades in your really strong set position. Yeah. This position on the elbow is more advanced. It is good, but it requires a lot more technique. and you need to focus on keeping your shoulders back. If you feel your shoulders rolling forward and dumping into your neck, you're going to get yourself into trouble. So you just want to adjust the hand position depending on where you're at. So if we come back up to here, that was puppy pose. Yeah. So in here in Sphinx pose, we've come down onto the forearms. So Sphinx pose is essentially exactly the same as Cobra. It's just not as high. You can see more of the abdominals are on the ground. You're still getting quite a nice deep back bend. And in here, you can be active or passive. So you can be contracting these muscles to stabilize and support the lumbar spine, or you can fully relax. So you kind of get that kind of that vertebrae mobility in the joint itself. Either one. Now, what you could do here, even some of my people in my class, when they come along, even this position where the elbow is underneath the armpit, that can be quite almost too strong for folks. Elbow underneath armpit, that's too much back bend. So you can either cue them to slide their elbows forward. So this lady here would have her elbows further forward, or you can even take the elbows out wider, and that will decrease the extension or back bend in the spine. Even coming down, so they're just resting on the base of the rib cage, so that kind of 12th rib, or even coming down, so they're resting on two hands on the fists, or just resting on your fists. They just a slight back bend or extension can be fine. The key thing is to allow people space and time to find the comfortable back bend position. Now, the other thing I'll say here is when you breathe in, the air is going to come down in through the nose, down past the larynx or the voice box, down the trachea, and then go into the lungs. And it's going to fill your lungs up with air. So you can imagine this space expanding as you breathe in. So when you breathe in, there's expansion. So that's a lifting feel, or that creates the back bend. So whenever you inhale, it's always kind of like a little lift up. And you can help facilitate that by inhale, pressing the elbows, chest up. And then exhale is about that kind of depressing the shoulder blades down and stabilizing and holding their position. So little subtle kind of adjustments on the inhale and the exhale, particularly if you're coming up and holding the posture, can be really, really helpful and really quite beneficial. Okay. Or you can do inhale up, exhale down, inhale up, exhale down, inhale up, hold, exhale, inhale, hold, exhale, inhale, hold, exhale, and come down. So you can kind of integrate breath in a couple of different ways with the movement. But essentially, whenever you inhale, it's creating spinal extension. Whenever you exhale, because the air's leaving the lungs, it's coming out. So that's going to deflate. So it's going to like create a sinking down feeling as the ribs come back together. So as you exhale, brace. That's when you want to really focus on the brace, the hold, the strong part of the posture, because you're really stable when you exhale. All right. So that's a video on spinal extension and passive and active in Cobra and in Sphinx pose. Hope you found that helpful. If you like what we do here, give us a thumbs up, like and subscribe. And as always, if you've got any questions, drop them down in the comments below. Great job on the Muscles in Motion app. Definitely get yourself a copy if you're interested, and we'll see you in the next video. Cheers.